Glaucoma is a common eye condition which can be called a group of disorders that cause an increased intraocular pressure, causing optic nerve damage and the loss of vision. The two most common forms of glaucoma include primary open angle glaucoma, which has a slower onset, and closed angle glaucoma, which occurs very rapidly. Some risk factors increase the risk of developing glaucoma. These include age, especially if over the age of 40, diabetes, a family history of glaucoma where someone in the family has or has had the disease, certain ethnic groups such as Afro-Caribbeans, eye injury, and some medication such as long-term use of corticosteroids. The pressure in the eye is referred to as intraocular pressure, and when this pressure increases, it causes ocular hypertension, which increases the risk of developing glaucoma. The intraocular pressure is determined by a balance between the production of the fluid in the eye and its drainage. But if too much fluid is produced and too little is drained, it leads to an imbalance, which causes the pressure in the eye to build up, causing a raised intraocular pressure. The ideal pressure in the eye lies between 16 to 21 millimeters of mercury. Let's have a look at primary open angle glaucoma, which is also referred to as chronic glaucoma. Looking at this diagram, normally what happens is that aqueous humor, which is the fluid in the eye, is produced by the ciliary body, secreted into the posterior chamber before being passed into the anterior chamber, and then it gets drained via the trabecular meshwork. But in primary open angle glaucoma, there is resistance to the drainage of the fluid through the trabecular meshwork. This then causes an imbalance between the production and the drainage of the fluid, causing the fluid to build up and increasing intraocular pressure. And this increase in intraocular pressure causes damage to the optic nerve. Primary open angle glaucoma is the most common form of glaucoma. It develops equally in both males and females. It progresses very slowly, taking months or even years to develop, meaning that the patient may not experience any symptoms at all for a while. But visible symptoms that can occur include patches of vision loss over time and blind spots. Another common symptom is an increase in intraocular pressure, causing optic nerve damage. Also, peripheral vision, which is the vision around the edges of an object that we normally look at, starts to become darker and blurrier. So let's have a look at the treatment of primary open angle glaucoma. Commonly, long-term treatment requires eye drops to be prescribed in order to reduce the intraocular pressure. The aim of the treatment is to lower the pressure below 24 millimeters of mercury and prevent significant loss of sight. First-line medication are prostaglandin analogues, which are well tolerated by patients. Examples include latanoprost, travoprost, and tafluprost. The PF refers to preservative-free eye drops, which are normally prescribed if the patient has a preservative allergy, for example to benzyl alkonium chloride. Prostaglandin analogues work by increasing the outflow of the fluid via the outflow pathway of the eye, and by doing so reducing intraocular pressure by around 25%. The usual dosing is once a day. However, they are contraindicated in patients who have a viral infection of the eye called herpes keratitis, and pregnancy and breastfeeding. Here are some of the common side effects of prostaglandin analogues. If prostaglandin analogues alone were not able to reduce the pressure in the eye, we move on to the second line, which adds a beta blocker eye drop to the prostaglandin analogue. Examples include timolol and cartilol. Beta blocker eye drops work by blocking beta-stimulated production of aqueous humor by the ciliary epithelium, reducing intraocular pressure by around 20%. Despite beta blockers being used topically in the form of eye drops, they can still reach the body systemically, so are contraindicated in patients with uncontrolled heart failure, bradycardia, and prescribed cautiously in patients who have asthma. This is because beta agonists are used to treat asthma. Here are some of the side effects of beta blocker eye drops. If the second line fails to reduce the intraocular pressure, we move on to the third line, which is the drugs used in the second line plus a carbonic anhydrase inhibitor. Examples include dozolamide and brinzolamide. They work by blocking an enzyme called carbonic anhydrase 2. This reduces the production of bicarbonate, and this bicarbonate is needed for the formation of the fluid in the eye. Another example of a carbonic anhydrase inhibitor is a drug called acetazolamide. Acetazolamide can be taken orally or by intravenous injection. If given orally, the dose is usually up to 1 gram a day in divided doses. It is given by intravenous injection for the use of an eye emergency, such as closed angle glaucoma. However, acetazolamide is rarely prescribed long term because of the side effects of hypokalemia, drowsiness, and paresthesia, which is pins and needles around the body. Here's a list of the general side effects that carbonic anhydrase inhibitor eye drops can cause. Fourth line includes drugs from third line plus a sympathomimetic agent, which are alpha-2 receptor agonists. Examples include brimonidine and apraclonidine. Alpha-2 receptor agonists increase aqueous outflow through the outflow pathway of the eye, but also decrease the production of the fluid in the eye. Side effects include reddening of the eye, blurry vision, and stinging of the eye. Fifth line adds a parasympathomimetic agent to the current treatment, for example, pilocarpine eye drops. It works by stimulating the ciliary muscle of the eye, which causes the trabecular meshwork to open up, and this causes the fluid in the eye to be drained through the trabecular meshwork, reducing the intraocular pressure. However, due to its undesirable side effects, it's kept last line. Now let's have a look at closed angle glaucoma. This form of glaucoma is less common and is a medical emergency. It occurs more commonly in females than males. It develops very quickly, and any delay in treating it can cause permanent damage to the eye. Let's have a look at this diagram. In this form of glaucoma, the trabecular meshwork, which is the drainage channel for the fluid in the eye, becomes blocked by the iris. This happens because of restricted flow of fluid through the pupil. This then increases the pressure behind the iris, pushing the iris forward onto the trabecular meshwork and blocking the trabecular meshwork so no fluid can be drained. This form of glaucoma occurs very suddenly, so the patient may experience symptoms of nausea and vomiting, severe headache, and the affected eye can become extremely red and painful. If not treated immediately, vision can become impaired very quickly. Treatment can be split into two categories: treatment by medication or procedural treatment, which includes laser or surgery. First-line drug treatment includes carbonic anhydrase inhibitor acetazolamide. This can be given orally or by intravenous injection. And as mentioned before, it works by blocking the carbonic anhydrase 2 enzyme, reducing the production of bicarbonate, which is needed for fluid formation in the eye. This reduces the pressure in the eye. Beta blocker eye drops can also be added to help reduce the pressure. Steroids can also be given, either orally or topically in the form of eye drops, which helps to reduce inflammation in the eye. Commonly, pilocarpine eye drops are also used. If the patient feels nauseous or has pain, antiemetics and analgesia can be prescribed. However, if drugs fail to reduce the pressure, a laser or surgical iridotomy is needed. This is when little holes are created in the iris in order to allow drainage of the fluid and so reduce the pressure. This form of glaucoma can later on affect the pressure in the other eye as well, so it is recommended that these procedures are done in both eyes and not just the eye that has been affected by closed angle glaucoma.